Hi, my name is Ashley Cifuentes, and this is the trauma assessment skill for clinicals. So I've determined the scene safety. No backup is here waiting for me. I put on my PPE. I see the nature of illness is just a scraped knee. My number of patients is 1. I do not need an ALS backup or any other backup. And I consider C-spine, and there's no need for C-spine stabilization. My general impression is that he's a 3 to 5 year old with a scraped knee, grimacing in pain, and crying. And he weighs about 100 pounds. The level of consciousness is alert. Hi, what's your name?
Logan,
What happened?
I fell.
What day is it?
Monday
And where are you?
on the floor.
Okay. He's alert times 4. So his chief complaint is his knee pain, and the bleeding. So I'm going to open and assess the airway, and since there is no C-spine trauma, I'm going to go ahead and do the head tilt chin lift and assess the airway. And the airway is clear and it's patent and will stay patent. I'm going to assess his breathing, and his breathing looks normal. I'm going to take his pulse and look at his breathing at the same time to determine the adequacy of breathing. He has adequate breathing, equal rise and fall of the chest, and a strong and bounding pulse. Since his breathing is regular and equal rise and fall of the chest, no non-labored, I do not need to insert an adjunct, OPA or NPA. There's adequate ventilation, so I would not need to use a BVM or non-rebreather mask hooked up to oxygen at 15 liters per minute. I need to assess any injury compromising his ventilation, and there is none, so I take no action. I already checked his pulse. There is no major bleeding. There's just a small cut on his knee. His skin is pink, dry, and warm, and there is no shock management needed because he is proper colored, his temperature is okay, and his bleeding is not excessive. So now as I do my trauma assessment, I'm going to be feeling the head for any dents or listening for crepitus. So, my name is Ashley, and I'm going to be doing your assessment. Do you have any allergies to medications or Henley? Do you have any allergies to medications or like animals or anything like that?
Nope.
Food,
No.
latex, anything like that?
No.
Do you take any medications in the morning? Did your mom give you any medications in the morning?
Nope.
Have you fallen before?
Nope.
When did you last eat?
2 hours ago.
Okay. Now, what were you doing when you did this, when your knee got scraped?
Riding a bike.
I'm checking for JVD and any tracheal deviation. As of right now, I don't feel any step-offs. I'm gonna be taking my stethoscope and listening to the chest for any abnormal sounds. Breath sounds are clear and equal. His pelvis is intact and stable. At this point, I would palpate the genitals to make sure nothing happened. Can you tell me which finger I'm touching?
Middle.
Okay. Can you wiggle your fingers for me? I'm taking a pulse. His pulse is present. Can you wiggle your toes for me? Which toe am I touching?
The middle toe.
Good. And I'm feeling a pulse. I feel a pulse. I'm feeling a pulse on this leg. Can you wiggle your toes for me? Okay. Can you tell me which toe I'm touching?
The big toe.
Okay. Taking a pulse, I feel a pulse. Wiggle your fingers for me. Which finger am I touching?
The ring finger.
Good. Good job. Nice. At this point, I would take precautions for this. I would, with my gloved hand, put pressure, as my partner would hand me a 4x4 square to replace with my hand. Then I would take a roller bandage and put it around until it created enough pressure to stop the bleeding. And if it bled through, I would put more dressings on top and pack more. And then I'm going to reassess every 10 minutes as he is stable. Every 15 minutes as he is stable.